pain in your shoulder that just won't go away, trouble lifting your arm, wearing clothes, or even sleeping at night. Many people think it's just a stress or age, but it could be frozen shoulder. Today we will uncover the truth with Ayurveda. I am Asla and joining me is Dr. Shakira, Ayurveda practitioner from Oasis Care Ayurveda.
Thank you, Asla. I am very happy to share my insight on frozen shoulder.
Doctor, what exactly is frozen shoulder and why does it happen?
Shoulder joint is a ball and socket joint which is covered by a capsule. If this capsule get inflamed, then gradually it led to fibrosed and stick to the surrounding structures. This leading to stiffness and pain, and gradually the range of motion gets restricted. This is the condition frozen shoulder, also called adhesive capsulitis.
Is there any different stages for frozen shoulder? If yes, how do symptoms change to one condition to another condition?
Yes, there are 3 stages in frozen shoulder. First one is the freezing stage, in which the patient complains of pain, especially in the shoulder and in the upper arm, and this pain will be present both in the active and in the rest, and also have night pain. And moving to the next stage, that is the frozen stage. At this stage, pain will reduce, but the stiffness will be more, and the patient feel difficulty with lifting anything from the shelf, combing hair, wearing clothes, etc. And move on to the next stage, that is the final stage, thawing stage. At this stage, the patient regain its range of motion, but without the treatment, he feel more time to regain its mobility.
Is frozen shoulder only about the shoulder or it linked with any other health condition like diabetes, thyroid problems?
Yes, Asla, it is often linked with other health issues. The people with diabetes, thyroid issue has a higher chances of getting frozen shoulder, and it is not just a local problem. It reflects deeper health imbalance.
Injury or surgery on the arms also trigger frozen shoulder?
Definitely. If the arm is immobilized due to injury or surgery for a long period, the capsule get tightens. It results in frozen shoulder.
Is it true that women get more than men? Why it is?
Yes, Asla. Women are more affected with frozen shoulder, especially at the age of 40 to 60. And the study shows that due to hormonal shift or metabolic corrections, this may happen.
Doctor, we often hear that patients complain about sleepless nights. Why does this frozen shoulder pain is worsen at night?
Asla, actually the answer for this question is unknown, but the studies shows that during night there will be more release of the melanin hormone. This melanin hormone trigger the inflammatory markers. This result in more pain at night, and this symptom is very common in frozen shoulder.
Doctor, can frozen shoulder affect emotional well-being too?
Yes, Asla. Actually, due to the constant pain and the movement restriction, they can't do the daily activities. As I already mentioned you, they feel difficulty to comb their hair, even dressing and taking something from the shelf also. So they get depressed, and they always depend to someone to do their daily activity. We know if we are depend to someone, we feel very frustrated. Like that, they also feel very frustrated. This led to their mental instability and reduce their work performance.
How does Ayurveda explain frozen shoulder?
Yes, Asla, it is a very good relevant question. And in Ayurveda, frozen shoulder is called as avabahukam, and it is caused due to vata aggravation. When this vata get aggravated, it dries up the inherent kapha in the shoulder joint. You think when you keep a moisturizer bottle outside, then it gets dries up. Like that, due to the vata activity, the kapha inherent in the shoulder get dries up, resulting in stiffness, pain, and movement restriction. That is the actual pathology in frozen shoulder.
Does Ayurveda see frozen shoulder as a local problem or part of the bigger imbalance of the body?
It is not just local, Asla. As I already mentioned, this frozen shoulder is caused due to vata aggravation. This vata aggravation is caused due to many reasons. It can be body factors or inherent factors or external factors. So it is not just a local issue, it is a generalized body issue, and Ayurveda considers it as a whole.
Doctor, what are the main Ayurveda therapies used for frozen shoulder and how that helps?
I will explain you Asla in detail. In Ayurveda, we usually follow the treatment based on the stage of the frozen shoulder, because I have already mentioned there are 3 stages, and based on the stages, the treatment is different. We usually started with Dhanyamla Dhara or Podikiri or Labam to reduce the pain and inflammation. Then we switch to the other herbal poultices like Jambira Pinda Swedam or Elakiri, like that, to reduce the stiffness. And in the final stage, to restore the joint mobility and to improve the strength of the muscles, we give Abhyangam or Pirichil, etc., like oil treatments. Along with that, in Panchakarma, Nasyam is used to restore the muscle strength. These are the main treatment guidelines we follow in frozen shoulder, and depending on the patient condition, we vary these treatments.
Doctor, do you also prescribe internal medicines? What their role?
Of course, Asla, internal medicines are very important. We usually focus internal medicine to reduce the inflammation and also restore the internal balance. So it is important.
Doctor, are these treatments are safe for diabetics or older patients?
Of course, Asla, our treatments are highly safe for the diabetic, elderly, or even heart patient, because treatments are highly customized based on the patient condition, their body type, and even season also. So it is safe.
Doctor, how long does it usually takes patients to notice improvement?
It is a relevant question, and usually in our clinic, so many patients ask this question itself. And in my experience, I felt in some patients we notice the improvement from the 3rd or 4th day itself. But in general, it takes 1 to 2 weeks to notice the changes. And the patient felt fast improvement in lifting the shoulder, but they feel difficulty with internal rotation and external rotation. But within 1 month, they usually gets the improvement.
Doctor, do patients need daily sessions or alternative sessions?
I usually recommend daily session. If patient come for a daily session, then the recovery is faster. But in Dubai, you know, it is very difficult to come daily session. But in our clinic, usually patients took weekly tries like that. Still, there is improvement. But I suggest daily sessions.
Doctor, what kind of exercise helps to frozen shoulder?
For frozen shoulder, we usually suggest the patient to do the exercises from the first day itself. First, I suggest exercises like pendulum stretch, wall climbing, then towel stretch, like that. Then I continuously monitor the patient's movement. According to that, I will suggest further exercises.
Doctor, is frozen shoulder is same as arthritis or cervical spondylosis? Because many people getting confused in both of them.
No, Asla, they are different pathologies. Arthritis and cervical spondylosis are different condition. Arthritis is a condition in which the joint has a lining that gets damaged, due to which the patient feel similar symptom like stiffness, pain. But in arthritis, the pain not only in the shoulder, besides they feel pain in the knee joints, small joints, like that. And in cervical spondylosis, that is a degenerative condition affecting the cervical vertebra. There also patients sometimes feel shoulder pain, but besides they also have the pain in the neck, in the hands. Along with that, they feel numbness, weakness, like that.
Actually, doctor, I just wanted to ask that is the surgery is the only solution for the severe cases, or Ayurveda can still help?
The thing is that in most cases, the frozen shoulder in advanced cases can be treated with Ayurveda, but in rare cases, we have to go for the surgery. It depends on the condition.
Doctor, does frozen shoulder heal itself if we left untreated?
Scientifically speaking, it gets recovered without any treatment. But in my clinical experience, I saw many patients suffer with this condition, that is with constant pain and stiffness for long years without the treatment. So treatment helped to recover faster.
Doctor, could you share your success story who recovered with Ayurveda treatments?
Very interesting question, and I am very grateful to answer this question. A male patient, 55-year-old, come to my clinic, complains of the shoulder stiffness, and he feel very difficulty to raise his shoulder. He is an IT worker. When he come to my OPD, he is very hopeless regarding the recovery and unaware about the Ayurvedic treatment. That is the truth. But I explained about the Ayurvedic treatment, and and give him 8 sessions of the treatment. By the third day itself, he shows some improvement, like he can lift his arm, he can do some activity like that. So he will be much graceful, and by the 6 or 7 sessions of treatment, he can completely do all the activities. And on the end, final day, he told me, "Doctor, I improved 100%. I am very thankful to you," like that. This is a short story regarding frozen shoulder.
Doctor, what is your message for the people who is living with frozen shoulder right now?
My message is very simple, Asla. Don't suffer in silence, because Ayurveda has a good treatment in frozen shoulder. So with proper Ayurvedic care, you can regain your mobility and can live without pain.
Thank you, doctor, for your valuable insight. If you are the one suffering from frozen shoulder, don't wait. Book your consultation with us, Oasis Care Ayurveda Medical Center. Thank you.